are you doing? Welcome back to another video on my YouTube channel. Today we are going to have a sit down video and we're going to speak about reproductive health. This is a topic that is affecting so very many women out here. I also put out a poll on my Instagram asking women if they know about pap smear, if they have ever done a pap smear test, and some of them gave response like they don't know what a pap smear test is, and the majority of the people have not yet done the pap smear test. So on Instagram, I don't think they allow very long videos. I think it's up to 3 minutes or so. So I don't think I'll be able to expound much on there. So that is why I decided to come onto my YouTube so that we can learn more about the pap smear test, so that I can enlighten 1, 2, or 3 people. And also that is another reason why I decided that is not talked about, and I just wanted to throw myself out there and speak about this because recently I got a scare and I said I will have to share this so that I can save 1, 2, or even 100 women, so that yeah, we can know more about our bodies and the tests that are required and everything revolving around reproductive health. So if this is your cup of tea or this is something you want to learn, grab a cup of coffee, grab juice, grab anything that is to your liking, so that we can educate ourselves today from me to you. So I have my notes written here. It's a lot. I couldn't just grasp everything, though some things are in my head and all that. But I have to, let me just check if my mic is working. Yeah, it's still working. So I just have to write everything down so that I can be at par, and maybe if I don't remember something, I can refer. So about reproductive health, we are going to specifically speak about the screening, the pap smear test, and all that. So majorly, we are going to talk about the pap smear. So what is a pap smear test? A pap smear test is a screening test that collects cells from the cervix to check for abnormal changes that could lead to cervical cancer. And why is it important for us to do a pap smear check, or rather a pap smear test? Because it checks for cervical cancer screening, which when detected early, or when the abnormal cells are detected, it could develop into cervical cancer. So when the abnormal cells are detected, it could lead to cervical cancer. So when you do the pap smear early enough, we will be able to know how or what, if you have either abnormal or not abnormal cells, and that could really save you from getting cervical cancer. Number 2, early detection. Early detection of abnormal cells allows for timely treatment. So if we get that you have the abnormal cells, definitely you can go for treatment, and you can be fully healed, because cervical cancer is something that people heal from every single day. So if we detect early, you can get healed. Another one is HPV detection. HPV stands for human papilloma virus. Pap smears can also be combined with tests for HPV, a commonly sexually transmitted infection that could cause cell changes that may lead to cancer. So HPV, human papilloma virus, is an STI. And if you are sexually active, if you have multiple sexual partners, this is something that could easily be transmitted to you. So that is why we go back to the normal, or rather the frequent checkup, by having or doing a pap smear test. So how is the pap smear test done? It's very quick and easy, but in most cases you'll feel discomfort, especially when the procedure is being done. Then afterwards, you might have some spotting or some slight bleeding, and with that you are okay. So a speculum is inserted into the vagina to allow the doctor to visualize the cervix. Then a small brush or spatula is used to collect the cells from the cervix. Then the collected cells are then sent to the lab for analysis. So it's just very quick and easy. Yeah, the procedure is quick and easy, and you may experience slight discomfort or pressure during the procedure. And it's normal to have spotting or light bleeding after the test has been done. But trust you me, it's in and out very, very fast, especially if you go to a doctor who has experience. It is very easy, and yeah, you'll feel slightly discomfort, but at the end of the day, you will have your results, and you will be helped accordingly. So now we've already collected the samples, they have already been taken to the lab. Automatically, we are waiting for results. So a negative result means that no abnormal cells were found. And that is great news. I know everyone who gets such news is like, even if you have been having multiple partners and your ways have not been straight, then you do the pap smear and the cells are normal, you'll be very, very relieved. And I think from there henceforth you will change your ways, because you wouldn't want such a scare again. But if the test results come and they are abnormal cells, it may indicate precancerous changes or other conditions that need further evaluation. So how frequent should the tests be done? The frequency depends on age and so many factors, which you will be able to discuss with your healthcare provider, and they'll advise accordingly. Then women should start getting screened at the age of, is it 21 or 25 onwards? And if you are sexually active, at least every year you should do a pap smear test. But if you don't feel like yearly, you want a doctor to be down there checking uh, out your cervix, at least 3 years, after every 3 years you can be going into the hospital and checking up on yourself and making sure that everything is okay. So I have mentioned that you can get, after when the results are out, you can get that the results bring out the test, as then they find out that you have abnormal cells. And I'd like to share a personal experience. When I did the pap smear, my test results came with the abnormal cells. And at first, I was very scared and I was so sick to my stomach. I was even telling my friend that when we were going for the pap smear test results, I was like, I'm so scared. I know something is wrong. And this also takes me back to this thing that I normally tell people all the time: always trust your gut. Always, always trust your gut. It has a lot to say. Always trust your gut and listen to it. So I got something called HSIL, which is called in full is high grade squamous int, intraepithelial lesion. So normally when that, after you've done the pap smear and the test results come back as abnormal cells, you can be diagnosed, let me say, with LSIL, which is low grade squamous intraepithelial lesion. And then there is HSIL, which is high grade squamous intraepithelial lesion. Then there is ASCH, ASCUS, then AGC. Those are what can be detected mostly from the pap smear if the results come with the abnormal cells. So personally, I got the HSIL, and later on we had to do a biopsy so that we can determine which grade of HSIL I had. So it is categorized in 3 grades, which is grade 1, grade 2, and grade 3. When you have grade 1, the body automatically fights it off, especially with a good diet, avoiding people who sleep with multiple, or rather people who have multiple sexual partners, exercise, and just diet in normal, and just taking care of yourself. Things like no douching, no using funny things down there. I don't know, oils and what that. So grade one, just your body is the one who will just fight it off if you just follow whatever the doctor has given out there for you to follow. So your body just fights it off. If you have grade 2 and grade 3, mostly treatment is done. Some of the treatments may need surgery, some of the treatments may need medication, some of the treatment may need like something will be cut, or rather something they just have to get rid of that part so that it cannot continue being in your body. So I just wanted to share this experience with you guys because I know someone somewhere is just seated, and mostly ladies, if you are getting frequent infections, please go to the doctor. Avoid over the counter medicines. These are the things that put us into trouble. You're like, this is the same as the last infection, let me just go and take some medicine, then I'll be okay. No, visit your gyna, because some infections which are very, very recurrent are the ones that lead to HPV, and HPV is an STI, and STI is brought through sexual intercourse. So if your man or your woman is cheating or is having multiple sexual partners, and you normally get infections all the time, please visit a gynecologist and stop going to the chemist to just get medication that surpasses the infection. Then later on, the infection comes back. You might be dealing with a bigger problem than what you think or what you expect, and that may lead to being cancerous in the long run. So we need to be on top of the game. Anytime you have some funny smell, anytime you have pain, especially while having sex, while urinating, any kind of discomfort, please visit your gynecologist so that you can get the help that you need. Anyway, guys, that's what I had for you today. I hope you've learned one, two, or even three things about your reproductive health. If you have any questions, please let me know down below in the comment sections. I'm not a doctor, but I am just speaking from whatever I have learned throughout the years about my body and whatever I have been told while visiting my gynecologist. Anyway, guys, thank you so much for tuning in. I'm going to see you on the next video. Bye bye.